Good afternoon. I am Ellen Jones, the Public Information Officer for the Anne Arundel County Department of Health. Welcome to the Health Department's first COVID-19 Facebook Live broadcast. Today, our Health Officer, Dr. Nilesh Kalyunaraman, and our Behavioral Health Director, Sandy O'Neill, will answer some of the questions that you've sent us through email as well as through the comments section of Facebook. Our email is covid19info@aacounty.org, or, as I said, the Facebook comments. So let's begin. Doctor?
Thank you, Ellen. I'm really glad that many of you have taken the time today. This really is an unprecedented time for all of us. We're talking today about COVID-19, and I wanted to share a little bit about what it is and also where we are right now. So you've certainly heard about it. It's a virus. COVID-19 is part of the family of viruses called coronaviruses. Right now, we're using those terms interchangeably, and we first learned of its emergence in the human population just 3 months ago. And what was noticed in China was that there were a large number of people who were dying from a new illness that was found out to be COVID-19. It's spreading, obviously, throughout the world, and it first landed in the United States on January 21st. We had our first case in Maryland about 12 days ago at this point, and since then, a whole number of changes have been put into place. Many of them things we've never seen before. The reason for that is that it spreads from person to person, and it can also spread when somebody isn't sick or showing symptoms at that time. That's the reason we're taking all these measures. There isn't a vaccine at this time. There isn't a treatment at this time. And so if you do get COVID-19, the symptoms are fever, cough, and shortness of breath. And those are the things that we're looking for and that you should be on alert for in case you have those symptoms, to contact your primary care or urgent care to see if you need any care. So what can you do to prevent it? There are a number of things that you can and need to do. One is making sure that you wash your hands frequently. And please use soap and water as much as you can. There is no shortage of soap, and it is just as effective as hand sanitizer. Now, if you're in a place without access to hand sanitizer, go ahead and use that. That's fine. Make sure that you avoid close contact with others. That's the social distancing, and you'll notice that we are spread out here for that reason. Normally, we wouldn't be this far apart when we were talking to you. Avoid touching your face as much as you can. You will see us do that today. We are trying not to do it just as much as you are trying not to do it. And the more we talk about it, the more likely we are to be able to stop doing that, or at least do it less than we have before. Cover your coughs and sneezes. Make sure you stay home when you're sick. All of us, if we have a little bit of a cough, maybe we're not feeling as well, we keep pushing and we go out. We go to work, we go to school. I know that many of you are not going to work at this time. Schools have been closed, but there are still other reasons to go out. We ask that you stay where you are, because that's what's going to be really important in preventing the spread of COVID-19. And make sure you clean and disinfect surfaces that are touched by others frequently. That's really important to kill the virus if it's on surfaces. So what do you do if you're sick? First of all, you want to make sure that you separate yourself from others as much as you can. And that means that if you have the ability to stay in one room, to do so, to avoid close contact with others, as we noted before, even family members whom you might otherwise have close contact with. Avoid sharing household items, and make sure that you monitor your symptoms. Right now, if you have mild symptoms, a cough, a low-grade fever, and you're able to manage on your own or with family, then we ask that you stay at home or stay where you are, and treat your symptoms. If you need help or advice, you can call the Department of Health COVID-19 Healthline at 410-222-7256, and we're open from 7:30 in the morning till 10:30 at night from Mondays through Fridays, and from 10 a.m. to 4 p.m. on Saturdays and Sundays. If you have more severe symptoms, you have a fever that's persisting for days, you have shortness of breath, then you should certainly call us or call your doctor for advice. Because there's no vaccine and there's no treatment, we're taking all these actions around social distancing because that's the only available treatment we have. And the goal of doing that is to make sure that we slow down the spread of the virus enough that two things can happen. One, our healthcare system has enough time and has enough beds to be able to care for those who do get critically ill. Many of you have seen the grocery stores where there's nothing left on the aisles because everybody went into the grocery store at once. Imagine if that happened in our hospitals when we needed it. That is what we are trying to avoid. And that is why we are taking these measures of closing down schools, closing down government, asking people to telework, closing down public spaces so that we can slow the spread down enough that we can take care of people when they get sick. And you are part of that, making sure that you are isolated if you have symptoms or diagnosed by staying away from others, and also by being quarantined. And quarantine is when somebody who doesn't have symptoms but has been exposed to somebody with COVID also stays by themselves away from others. Those two actions are critical to help slow down the spread of COVID-19. I'm going to leave it there. I'll say more when we're wrapping up, but I want to turn it over to Sandy O'Neill at this point.
Thank you, and I'm glad to be here. I think one of the things that has come up almost as often as what can I do and what is happening with the COVID virus is how do I manage my anxiety? So one of the things that I'm glad to be here to talk about are your questions related to how do I manage this for myself, and maybe how do I manage this for my kids? We'll be talking about some ideas I think that you can easily do when you're talking to your family, talking to your kids. First of all, we want you to take care of yourself. So manage your own anxiety, your own feelings. We want you to talk to your kids very calmly, honestly, ask them open questions, talk to them about what they are feeling, what they want, how they want to handle things, rather than jumping in and trying to just reassure them or answer what you think they're asking. So I'm really looking forward to what other questions that you may have and see if we can help you manage this storm a little easier.
Thank you. The first question is, how long will COVID-19 last, and how long will all the closures last?
That's a great question, and that's one that we are constantly trying to understand ourselves. So we are going off of the experience of what other countries where COVID-19 came first. So you've heard certainly that in China, in Japan, in Italy, in South Korea, COVID-19 appeared before it did in the United States. And so we're learning from them as to what it looks like. And so we know this is going to go on for weeks, potentially months. Right now, we're trying to understand not just what will happen, but the effect of the measures that we've taken. I want to commend both the governor and the county executive for taking swift action, because that's what's been shown in other countries and other states to be very effective at decreasing the rapid spread and giving us time to be able to care for people. So I don't have a firm answer for you at this point, but know that it's going to be weeks into months.
Thank you. The next question is, will either the state or the county release information on where infected individuals have been so we can know if we have come into contact with them?
So we are always trying to balance a person's private health information against the public's need to know about things that are dangerous. And so we generally don't release specific information about people and their condition. We obviously do share that there is a case in the county, and general information such as somebody's in which decade of life they're in, but we won't share specific information about where it is. What we do is that we actually do what's called contact tracing. That's where we have an intensive discussion with the person and talk to them about who they've been in contact with, and then we talk to those people to see what their risk is, and then we keep going as is needed. So generally what we'll do is that if you've been contacted, then you will know that you were potentially exposed to somebody, but we don't release that information to the public as to specific location, which exact town or city. We don't do that to protect their privacy.
Thank you. One of our followers wrote, I have scheduled doctor's visits that are non-essential, such as eye exams and dental cleanings. Should I still go?
So we generally recommend that you don't, that you defer any of those types of visits that you can for two reasons. One is that we want to reduce the number of people who are coming in contact with each other, and any of those types of healthcare visits involve close contact between people. And so we're trying to limit that. And the second reason is that those visits require personal protective equipment. Those are the masks, gowns, face shields, gloves that are a part of those visits. We are trying to save them for those cases in hospitals and urgent care centers where we need it. As I mentioned, we know we're going to see increased need for hospital services, and we have a shortage of supplies right now, so we want to save it for that. So for those two reasons, we ask that you defer anything that's not an urgent or emergent visit.
Regarding mental health, what are some things I can do to ease my anxiety and fear of the future and uncertainty?
I think that is the biggest question that has come up time and time again, and I think it is something that we can all do a little bit better at. So in terms of managing your own anxiety and fear, staying informed, but not over-informed. So a lot of times people are sitting in front of the TV just absorbing every piece of information that's coming out, and that may not be very helpful. It may be more helpful to schedule the time that you are looking at information about the virus. It may be helpful to limit your sources of where you get your information. And then spend some time away from it. Take a break. When you can, take a break from all of the coronavirus things that are happening in your world. Do something that you enjoy. Do something that's fun. Spend some time working on your hobbies or reading a book or finding what your hobbies are. Take some time. Now, one of the things that we think about when we talk about doing that is, oh, we should do meditation and we should do yoga. And those are wonderful activities. But also hiking is a great activity. You should really think about the things that work for you and do more of those, and work to just acknowledge that this is a very uncertain time. We've not been here before, so no one has all of the answers that we would like to have. So we're going to do the best that we can. There's a lot of gray area here. So limiting your exposure, your overexposure to the news, practicing whatever coping skills work for you, again, whether that is yoga or hiking, avoiding drinking too much alcohol or using other illicit substances. That is always, always going to make it worse. And staying connected with people. So staying connected at a nice, safe distance, maybe using the phone, maybe using FaceTime, Skype, all of those other kinds of options, but staying connected to your people.
Thank you. Exactly how does COVID affect pregnant women and their babies? And what about breastfeeding?
So those are good questions, and that's something that we've been asked as COVID spreads. We don't really have a lot of information about that, and the reason is because it's so new. And so what we recommend is for any pregnant women or new mothers that you talk with your doctor about these issues, and that you certainly, if you have any of the symptoms of COVID, the cough, the fever, the shortness of breath, you get in contact with them immediately so that they can be informed and direct your care.
Thank you. And can our pets get coronavirus? And do they get it from their humans or other animals?
That's a good question. So coronavirus, the large family, not the COVID-19 that we're talking about, but coronavirus, the large family of viruses, is in humans and a lot of other animals actually. And when this first was identified in China, we suspect that it actually skipped over from either a bat or I think an armadillo into humans. But at present moment, there isn't any evidence that pets can get COVID-19. But we're also just so early into this that I'm not sure that we've had the time to even know the answer to that yet. But right now, there's no evidence of that.
Okay, that's good to know. What is the health department doing to reach out to vulnerable populations like seniors and those with less access to public health information?
So we're working with our partners to reach out to provide them information. We've been working with our Department of Aging and Disabilities pretty intensively, and they've been taking the lead on that in terms of reaching out to seniors and getting them the information that they need to be able to navigate this public health crisis. We've been working with Department of Social Services to work on how we reach out to homeless individuals and homeless service providers to not only to share information but also to understand what the shelter needs are and how do we make sure that we manage that not just now but as we go along if somebody gets sick. We also want to make sure that those who are chronically ill, so the three groups at greatest risk are those who are older, generally those who are 60 and above, homeless, and those who are chronically ill. Understand their risks and take those precautions that we noted and take them very seriously.
Thank you. Sandy, how can I help my child feel less stressed and answer questions they may have?
I think that is a wonderful question and one that is best answered in some respects by you. So you know your child. You want to approach your child from a place of calm yourself. You want to approach your child using language that they can understand. Answer the questions that they're asking, which means you have to listen to what they're saying. So listen to what they're saying and not jump in and try to give an answer because they may not be quite asking you what you think they're asking. So listen to them and then give those answers in language that they can understand. You're going to talk to your 5-year-old very differently than you're going to talk to your 15-year-old. Talk to them about what the facts are with the COVID-19. Talk to them about what you are doing as a family to take action and what steps they can take to keep themselves safe. That this is a family process that we're all going through to keep each other in a healthier place, and we can all be part of that solution. One of the things that I would say we want to be sure to do is to create opportunities for these conversations to happen again and again so that they become more natural, and when your child approaches you, you don't kind of stop with ooh, what am I going to say? But that it can just be an ongoing conversation. You can look for those moments when you're doing something and you can point out to your child, I'm singing the happy birthday song twice while I'm washing my hands. Or help your child pick out a song that lasts 20 seconds and wash your hands together. And then when the conversations are coming to a close, be sure that you extend the invitation to the child to talk to you, or maybe there's another trusted adult in their life that they can talk to about their fears so that they can share that and it doesn't become this big taboo subject.
Thank you. If you think you have COVID, who are you going to call first? The health department, a private doctor's office, emergency room?
So if you think you have COVID, we certainly encourage you to call your doctor. If that's not an option for whatever reason, we encourage you to call the Department of Health at our number, as I mentioned, 410-222-7256, and we can help go through what your symptoms are, what you're feeling. If it's a life-threatening emergency, of course, don't wait. Go to the emergency room. But if you do have some time, we do ask that you call because our emergency rooms are being overwhelmed right now. And one of the things we want to do is try to make sure that we get people the appropriate care they need when they need it.
Thank you. Do you have to have a fever to have coronavirus?
You don't have to, but 90% of people who were diagnosed with COVID-19 do have a fever. So it's probably the most common symptom in it, but it's not a necessary symptom. As we mentioned, cough and shortness of breath are also two of the three major symptoms in addition to fever.
Is there any planned drive-through testing in the county?
So right now, we are working on drive-through testing in the county. As you probably know, the biggest issue, not just in the county or the state, but nationwide, is the limitation of the number of tests. And that starts with test equipment and also lab, and ends in where the lab capacity is to actually run those tests. Most of the tests take about 3 to 4 days to return a result right now. And so as part of our planning for this, we're looking at how those supplies ramp up. So the answer is yes, it is in the planning stages right now, and we hope to be able to launch that in collaboration with partners in the coming days.
Thank you. I have symptoms, but how do I locate places that are testing currently? Is there a waiting list?
So if you have symptoms and you want to get tested, we encourage you to call the Department of Health first. For mild symptoms, we are generally recommending that people stay where they are and take supportive measures like over-the-counter medications, making sure you're hydrated, eating, for two reasons. One, because we want to limit the person-to-person exposure. And two, when there are limited tests, we're not going to test people with mild symptoms. Now, if tests become plentiful, that advice might change depending on circumstances. But right now, if you have mild symptoms, please call the health department first.
And with social distancing, please address how people who wish to pay their respects to the deceased and comfort the family are supposed to do so under the current restrictions.
That's a really good question, and it's one that we've been thinking about for the past few days. To the best of your ability, we recommend limiting the number of people. We recommend the social distancing that's required, and we don't really want to end up in a situation where we are inadvertently getting others sick. And so those are decisions that you're going to need to make with your family and your close friends to figure out how you can pay those respects in a way that also keeps you safe. There isn't a perfect answer to that question, and that one question is a good example of the challenges we face in social distancing. It's not something that comes naturally to us, and yet here we are.
Another social distancing question, Sandy. Social distancing has me feeling very depressed. Is there something I can do to cope with this feeling?
There is. Social distancing is very different than social isolation. So someone who is aware that they are starting to feel isolated and depressed is a step ahead because they're recognizing that. And what you want to do, as simple as it sounds, it's not always easy, is to reach out and connect with someone else. And think of those creative ways that you can do that, whether it's through a text message or an email or FaceTime or any of those other technologies that we have available to ourselves now. We want to stay connected. That's very important, not to wind up feeling like we're the only person sitting with these feelings.
Another mental health question. How can you help clients with low income and lack of technology access telemed services for mental health and health care?
Great. So one of the things we've been doing is reaching out to the providers in the community to find out who is still open, who is taking new patients, and we're really trying to keep our finger on the pulse of who is able to see people. Most of our providers are offering telemed, so the interaction very similar to a FaceTime application. For individuals who don't have that, if you already have a provider you're working with, I would give them a call and see what other arrangements that they could make. Some are doing simple phone contact. If you don't have either of those and you're not sure where to turn, I would recommend calling our warm line, which is 410-768-5522. And there's a clinician that answers the phone, and they will talk to you and help guide you through whatever the process is to get you connected to somebody that you can talk to.
Thank you. Now a question about children. Should we allow our children to play outside in small groups? What about bike rides? What about contact sports?
Generally, we encourage children to play outside. That's something that's good in general and particularly good now. We're also recommending that when you have children, they do want to play with others, and so if that's something that you are comfortable with, that you form a core group of people with whom your children is interacting. For example, when they go to school, they're interacting with tens, hundreds of other children. There's one or two other friends that they can be that core group. That limits the number of people that your child is being exposed to and helps decrease any potential spread. Activities like running, biking, those you tend to have more distance from others, and so those are great. We do recommend that contact sports be suspended for the reason that people are up against each other constantly, and then you don't have that distance. And so that's the reason why you see school sports, rec leagues have closed down because of that close contact. But we know certainly the kids go out to play, and so we would discourage those types of sports.
Thanks. Another children's question. What is the risk of children staying at daycare providers and spreading the virus to others, including their family members?
That risk is certainly there, and it's why we've daycares have gotten guidance about what type of cleaning and hygiene they should be practicing. Also limiting the number of children who are in any one group. Those limits already exist, but we're trying to tighten them up so that there are fewer children in contact. At this time, for parents who have to work, there aren't many options. If you have to send your child to daycare, then you have to send your child to daycare. But we would encourage you to talk to your daycare provider to understand what they're doing to limit the spread of infection. And the other thing that you can do is if your child has some mild symptoms, I think we all know this and we're all guilty of it. Sometimes you try to send your child to daycare or school. Many of us are guilty of giving them a little Tylenol or Motrin and sending them on their way. Now is the time that you can't do that. Now is the time where you have to actually say, you know what, my child has some mild symptoms, but I'm going to keep them home today and until those symptoms resolve. That's the part that you can play to help stop the spread.
Can COVID-19 virus be killed by cooking temperatures of 165 degrees or over?
So generally, what we find is that when we look through the research is that COVID-19 isn't spread through food, and that's both prepared heated food and unheated food. So we haven't really seen that as a mode of transmission. We certainly recommend that you cook your food appropriately at all times.
Okay, thank you. Now, how long does the virus stay active on a surface or a food container?
So the virus stays on surfaces. It can last for up to 3 days on hard, non-porous surfaces, so things like metal or plastic. On more absorbent surfaces like cardboard or clothing, it tends to last for less than a day. And those are the general guidelines that we have. It's not the most efficient mode of transmission, but as we noted, for those hard surfaces that are being frequently touched, that can be a way to spread the virus.
Thank you. And another sort of food-related question. If sick restaurant staff are required to work, does that need to be reported to the Department of Health?
You can certainly report that to us. Employees who are sick should be able to call out, and that's for any number of reasons. There's sick and safe leave, which was passed in Maryland, but also at this time, employers really need to be vigilant about how they are part of helping prevent the spread of COVID-19. So if you're having trouble with that, you can call the health department. We'd be glad to help route you to how we can help with that situation.
Thank you. Now, this question relates to mental health, and that is why does COVID-19 make me have excessive eating as well as excessive drinking?
So, as far as I know, the virus is not making you want to excessively eat or drink. Those are perhaps coping skills that you may go to that aren't the best coping skills. So, I think if you know that you are somebody that you turn to food to when you're feeling anxious or sad, or that you have a drink or two or three when you're feeling anxious so that you feel less anxious or don't feel anything, maybe recognizing that you tend to do that and trying to come up with a plan for something else. So you might want to remove those environmental triggers, that you don't have the bag of chips sitting right there on the counter, or the cookies or the ice cream or whatever it is that you may eat, and that you don't necessarily keep much alcohol in the house or within your line of sight, so that it's not the first thing that you see when you're feeling stressed. So when you're feeling stressed, think of something else that you can do that might help you with those feelings, whether it's doing some deep breathing, going outside. One of the wonderful things that I think we have right now is the spring weather is coming, and it is beautiful out there. Even just going outside and standing on the back porch and taking a deep breath can help relax some of that anxiety and remove some of that sense that you want to drink or you really need to eat that bag of chips.
Thank you. Is there currently a nationwide shortage of protective equipment for healthcare providers, and what kind of help is available?
We certainly are seeing that there's a shortage. I know that we've heard about the mask shortage. I will take this time to note that masks are not helpful for the general public. They were never devised to be used that way. They're really intended for healthcare workers to be able to decrease the spread of infection. We're doing a couple of things. One, I mentioned earlier, deferring routine healthcare visits so that we can save that personal protective equipment. Hospitals are canceling elective surgeries as well. That'll help conserve that. The Strategic National Stockpile, which is a stockpile of personal protective equipment and other supplies, is being made available by the federal government. And we in Anne Arundel, we're getting a shipment, I think it's today actually, that we're getting a shipment that includes those supplies. And the last thing is we ask that if you did buy up a lot of equipment or you have it, we would actually appreciate if you could contact us and let us know. Those are the sorts of things that we would be able to increase our supplies so that we can give them out to other healthcare workers who are constantly asking us for help in getting that.
Thank you. Just a couple more questions, and then we'll have a summary here. Are certain professions, such as dental hygienists, cosmetologists, and massage therapists, at high risk for infection?
So we do know that the dentists, dental hygienists are at fairly high risk because of the way that they operate. They're working with somebody whose mouth is open and breathing on them, and their faces are close by. So the recommendations by the American Dental Association and dental societies is to defer all non-emergency dental procedures. And we're really suggesting that everybody, all types of services, anything that's not an emergency, be deferred at this point. So the fewer of those person-to-person contacts we have, the better we're going to be at slowing the spread down.
Okay. And our last question. What is the best practice for preventing the spread of disease with daily chores, such as going shopping with the shopping carts, steering wheels, your purse, your wallet, your iPhone?
So the best practice is really to think about why you're going out, and can you get everything done. So good example is if you're going to the grocery store, can you get everything you need for the week instead of going back multiple times that week? When you go, try to go at a time where the number of people there is fewer. If you see a long line, don't wait there with everybody else. Pick another time if you can. And make sure that you're wiping down surfaces that are being used constantly or using hand sanitizer, and using hand sanitizer or washing your hands to make sure that you decrease the spread if you're going out. Things like your iPhone, if you're the only one touching it, your steering wheel, you're the only one touching it. If you're washing your hands and you have good hand hygiene, they're okay. It's more the surfaces that are being touched by a lot of different people that are the concern.
Thank you. Now for our wrap-up. Doctor?
It's really good to be able to have this time with you today. We're going to continue to do this every week because we know that there are a lot of questions as we got today, and we're going to cover different topics each time. One of the key things to remember is that this situation is going to change, and so some of the things that we advise today are going to change tomorrow. But I want to just kind of wrap up with the basics, which is that each of us has the ability to make this situation better. Sometimes they seem like really small actions, such as not going to the store when others aren't there, or keeping that 6 feet away instead of getting close. But each of those actions builds up. And those are the kinds of things that are going to help us get through this together. Because ultimately we are in this together. This is a public health emergency at this time. And so doing those things that we talked about, making sure that you wash your hands or use hand sanitizer, keeping that social distance of 6 feet, and minimizing your activities outdoors that are in contact with others, avoiding touching your face as much as you can, staying home when you're sick, staying away from others when you're sick. Those are really the key steps that you can take to help limit the spread of this disease and slow it down.
Thank you. And Sandy?
I would add that some of the same things that you may be doing to keep yourself physically well are going to help manage some of the emotions that we're all feeling right now. Making sure that you get enough sleep, making sure that you are eating balanced meals, getting some exercise, some activity, moving around, not just sitting in one place and really dwelling on what is happening. And I had another point I wanted to make. Oh, I think most importantly, we can choose to look at this as a time where we're being kind of sent home, or we could maybe challenge ourselves to look at this as a little extra vacation and a time to connect with our families. So if you can kind of turn that on its head and look for opportunities to reconnect with somebody, and if that somebody is yourself, even better, rather than a time of being sent to the principal's office.
Thank you for joining us. To stay in touch, you can email us some additional questions at covid19info@aacounty.org, and you could also call us at 410-222-7256. We'll see you same time next week. Thank you.